Hello, welcome to inCAV. Today we're going to show you how to use the Nellcor OxiMax N595 oximeter. First off, what we have here is the Nellcor, of course. It's off. In order to turn it on, all you have to do is simply press the power button. Give it a moment. Your screen will appear. Now at that point also, if there's any errors or messages or anything, you'll see a code come up. Of course, this one is in good running condition. Now we're going to actually install the extension cord and the finger monitor here. This is both pediatric and adult. So as you can see, you just simply find the little insert cutout here, put it into place, it'll click lightly, and then at that point your sensor will actually light up red and you know it's good to go. Now if you decide, or for whatever reason it comes out, it's going to warn you that the sensor is disconnected. You can simply hit the alarm button here to silence the alarm and plug it back up. And of course you'll be ready to. Okay, now that you have your finger monitor ready, all you have to do is insert the patient's finger. That's it there. And you'll actually see the oxygen reading come up. Give it a second and your heart rate will come up as well. Now from here you have your different options. As you can see, you have your limits. This will allow you to change from neonatal to adult. Neonatal. Now once you're in neonatal, of course, if there's a difference in the pressure, the alarm should sound. Now as you can see, the alarm is sounding because it is in neonatal mode. That allows us, if a child's heart rate or anything is off, it's going to sound the alarm. And simply mute it. Go back down here to limits. There's your neonatal, and then here's your adult setting here. Now when you do hit the alarm button, keep in mind that will mute your alarms. So you always want to, once you've done whatever you need to do here, take the mute button off, so that way you can hear any alarm that's necessary at the time. Now you also have your trend monitor here, and then this will allow you to change your view, whichever one you want to actually see here, which is trending. So there's the O2. When we go to pulse, there's the pulse, and then once you've gotten your information, you just simply back out, exit. You have your setup. This right here will allow you to actually change the view from the pleth and the blip. Right now it's in blip. We're going to change it to pleth. And then of course you can go back. You go back to your blip, whichever one you need at the time. Once we have that, also you have your sensor. This is where you can actually save your data. Sensor R is on, so it is reading the O2. Go back, message. Sensor message is enabled, so you do see the messages on the screen. And then once you've completed that, all you have to do is exit. And then of course, for your patient at night, all you have to do, turn off the screen, is hit the light, and then bring it back on. That concludes our video on how to use the Nellcor OxiMax N595. Thank you for watching. If you need to contact us, simply visit our website at inCAV.com, and we do repairs, refurbish, new, used equipment at any point in time. Just contact us, and thank you very much for your time.